But you don't start with big projects, because it is a change of thinking, of working, of making decisions. So you build up phases one by one by one. You start with small questions, you learn from it, the organization learns from it, you build acceptance, right? If you want to build a system like this, to start a complete system like they have in Ottawa straight away, then you're several million pounds further down the road, and 3 years further, and you're building a system that fitted today, but not tomorrow, right? What you want to do is actually look at phases of about 2 to 3 months delivery to have value and to make it adaptable and to make it change. And then make sure that it is not a project, it's a process of projects. And we propose to use CRISP-DM, the cross-industry standard process for data mining, which is a freely available methodology for these types of approaches, developed in the past by SPSS and others, funded by the European Union. And there's a booklet, kind of a cooking guide for people to actually get an idea of how the whole process works. But it is a process, and it's also important to document what you're doing, to transfer knowledge, but also to transfer it and to validate it, right? There's 2 areas where I always say that documentation methodology is very important. One is in medicine, and the other one is in crime and investigations, right? Because they need to be able to protect their decisions in front of a judge. But here you also need to protect and you need to share with others, and especially in the NHS. If you develop something in Warwickshire, why not actually look, okay, can we take that process? Maybe you cannot take the exact model because the model is dependent on the population and the area where you are and local intricacies, but the process can be transferred to others. So you can actually build a process in Warwickshire, document it, and then transfer it somewhere else within the NHS, and they can say, okay, we've got a starting point. Can we now adapt it to our situation? And some of it may be national, right? Some of it could be actually overarching, and then you use that as input for your local models. So why is IBM here? Of course, we sell software. But we sell software to actually cover kind of the process. You capture data, right? So we have what we call social media analytics, to capture information from social media. Now, everybody is always full about Facebook and Twitter, and you know, it's garbage, forget it, right? But you do have all kinds of forums and sites where people talk about their illnesses. Patient organizations usually have sites where there's a forum about that specific illness, and as medical population, you can learn from that. What are they experiencing? How are they feeling? Right? Data collection is questionnaire. Now, we've always done a lot in medicine with questionnaires and in hospital things, but you can do a lot more. The Dutch Inspector General for the Healthcare uses data collection to collect information about quality incidents. People can actually report an incident there anonymously and enter information about that through data collection. The CDC uses it to very quickly and adaptively deploy surveys into areas where infectious diseases have broken out, so that they very quickly can get the information and contain it, because you can collect data not just on paper or on computers, but you can do it on handhelds, you can do it on iPads, you can do it on any type, you can even do it by SMS if you want to. Right? But yeah, I'm wrapping up.
Questions.
So the predicting, the analyze and predict, that is of course the core business that I've been talking about. And then the act part is how can we actually get the information into the right place in the organization, right? Can we integrate it into our system? How do I get a risk advice to a nurse or or maybe how can I predict the length of stay, and how can I get it in front of somebody who does the planning and the scheduling?